Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hey everyone, this is Chase and welcome back to the Wellness Center podcast. I am really grateful you guys are here today. If you haven't already, please make sure to like and subscribe so you can get up to date on all of the most recent information that we're going to be talking about. Today, we've got a topic that is actually really close to my heart, which is major depressive disorder. People who struggle with depression, clinical depression is another name for it. It's one that I'm actually very familiar with in my personal life. So I'm really excited about this study. This one was published just this last week, and I'm super excited to check it out. Like always, I'm going to be going over three main things. I'm going to go over what is major depressive disorder for those who might not know about it. I'm going to go over a red light therapy or photobiomodulation peer-reviewed scientific published study that's going to talk about some of the results that red light therapy has with major depressive disorder, as well as some at-home remedies to help you guys out in adjunction therapy to coming here to the Wellness Center and treating yourself with red light therapy. Let's get right to it. So again, just a reminder as always, this right here is my camera. Right over here is my computer. So if I'm looking over here, I'm not ignoring you, I promise. I am just looking at my computer. One other thing too, I did get a review that a lot of people were having a hard time reading what was on my computer screen. So I've increased the size of that to hopefully make it a little bit easier for you guys. So let's get right into it today. So I'm going to share my screen. All right. So right now we are on the mayoclinic.org and we are going over depression, major depressive disorder. Now, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel like life isn't worth living, which can lead to suicidal ideation. More than just the bout of the blues, depression isn't a weakness, and you can't simply snap out of it. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both. So guys, I think I know that back in 2015, I ended up admitting myself into the hospital with suicidal ideation. And I had a doctor there. I don't remember his name, but he was terrible. And he says, you can just choose to be happy. You can snap out of this. And thank heavens, my mom knew better and chewed the doctor out at like 4 a.m. This poor ER doctor was getting an earful from my mom. Rightfully so, though. He didn't know. You can't simply snap out of major depressive disorder. Don't ever let anyone tell you otherwise. It's a long-term treatment. Sometimes people struggle with it their whole lives. However, there are some things you can do to help that. So let's go over some of the symptoms of major depressive disorder or clinical depression. Feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability or frustration, even over small matters, loss of interest or pleasure in most or in all normal activities such as sex, hobbies, and sports, sleep disturbances, including insomnia or sleeping too much, tiredness and a lack of energy, even small tasks, can take effort, reduce appetite and weight loss or increase cravings for food and weight gain, anxiety, agitation, restlessness, slow thinking, speaking or body movements, feeling of worthlessness, trouble thinking, concentrating, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or completing suicide, and unexplained physical problems such as back pain and headaches. So there we go. And there's so much more. I will post this link in the comment, or not in the comment section, in the description section. So if you want to read more about this, you're more than welcome to. I try and keep the podcasts always under 10 minutes. So it's a nice, easy listen. You can listen to it on your commute to work or on your break. Now we are here at the MDPI and we are looking at a study that they published about transcranial photobiomodulation, which is specifically just like a helmet on your head, and major depressive disorder. Now, we're a little bit different. We're not an outfitted piece like a transcranial photobiomodulation device. We're a full body pod. So not only are we going to tap into your brain with like the transcranial headpiece, but we're touching your whole body as well. Now, we're looking at the clinical effects of transcranial photobiomodulation on major depressive disorder. Now, 2 studies conducted by our team over at MGH suggested that transcranial photobiomodulation is feasible and safe in patients with major depressive disorder. In the first study, 6 sessions of adjunct transcranial photobiomodulation in 810 nanometer irritants with 700 milliwatts, similar to the higher dose tested in present studies, delivered to the people twice a week for 3 weeks. So again, twice a week for 3 weeks, 6 sessions. That's typically what we tell people. The newest science says it takes on average 6 sessions before you notice results. And once you notice results, it's up to 12 sessions to finish an entire course. So again, this is just another confirmation that photobiomodulation takes time. For 3 weeks, in 4 majorly depressed subjects led to a decrease in depressive symptoms, and they were testing that through the Hamilton Depression Rating Scale. Scores decreased from 19.8 plus or minus 4 and 13 plus or minus 5. So transcranial photobiomodulation at the high dose was well tolerated without any serious adverse effects, SAEs. In a double-blind sham-controlled study, 16 sessions of adjunct transcranial photobiomodulation with an 823 nanometer irritant, similar to the lower dose used in the present study, delivered to the group twice a week for 8 weeks. Twice a week for 8 weeks, guys. 16 sessions. That's more than the standard course of 12. So again, it takes time. In the major depressive disorder subjects led to a significantly greater decrease in depressive scores in the near-infrared group versus the sham group. So it decreased from 15.7 versus the sham at 6.1. Transcranial photobiomodulation was tolerated with no serious adverse effects. Of note, our clinical pilot study demonstrated a large effect size and reached significance with 13 subjects completing the treatment. These data support the potential clinical efficacy of transcranial photobiomodulation. So guys, again, we can help with major depressive disorder. We have protocols, one that we actually just recently developed to target major depressive disorder specifically. I've done it myself and felt, for me, it was the first session I came out. I felt super, super chipper. So now we're on WebMD, and we are looking at some at-home remedies that you can do to help with your major depressive disorder. The first is get a routine. Routines. Depression can rip away structure. So if you're battling the rip away of structure by setting a routine, that can help with the mindset. Set goals. You can exercise. You can eat healthy. You can get enough sleep. You can take on responsibility. You can challenge negative thoughts. You can check with your doctor and use supplements. And you can do something new. Try to have fun and avoid alcohol or other drugs, which are suppressants and depressants. There you guys have it. Transcranial photobiomodulation, full body photobiomodulation. Can help with your major depressive disorder. We here at the Wellness Center have the gold standard of red light therapy, meaning that we have the best. We are the best. We do the best. So I invite you guys to come down. Your first session is totally free. You can contact us at 801-800-2484. You can email us at info at thewellnesscenter.life, or you can go to our website, www.thewellnesscenter.life, to book your first appointment. And again, it takes about an hour your first time for the consultation, and then 20 minutes or 30 minutes going forward, depending on the protocol that you choose. Everyone, thank you so much for tuning in today. I hope you have a great rest of your day. Please, again, make sure to like and subscribe to the channel, and we'll see you on the flip side. Peace.